So I am about to start an IV on this patient, and as I walk into the room, I've gathered up my supplies, which is a catheter, a start kit, some gloves. I'm going to ask the patient their name. They're going to tell me their name, their allergies, whether or not they are allergic to any type of skin preparations. So I have already primed my IV line, so that's ready to go. The first thing I'm going to do is open up my IV pack. Mr. Jones, I'm going to start an IV and some fluids on you today so that Mr. Jones has some idea what's about to happen. I'm going to take the tourniquet out of the package, and even though I think I'm going to start it in the hand, I'll put the tourniquet above the elbow. When you put a tourniquet on, you do cross it, you make it secure, and you tuck it so that the tails are toward the head and out of your way. Once the tourniquet's on, you can definitely assess where you want to start your IV. And I'm going to put my IV in about right here. I'm going to take into consideration the length of the IV catheter itself so that it does not land on a joint. Once I have identified my site, I'm going to release my tourniquet. At that point, I'm going to pick up the chlorhexidine gluconate, this little prep, and all of the different kits are a little bit different. You activate this by squeezing it, and then you clean your site. Up, down, across, round in a circle, it doesn't matter. It's the friction that cleans it. You just want to make sure that you do clean the point where you are about to insert your line, and then you allow that to dry. On a human being, it takes about 30 seconds to dry. On this mannequin, it will seem like it never stops drying. It'll seem wet the whole time, but we're going to advance. At that point, I'm going to put on my gloves, because I want to keep myself as safe as my patient. I'm going to open up the last of my equipment, which is the catheter itself. Set my trash off to one side. I'm going to reactivate my tourniquet. Now on these mannequins, the vein's going to stay nice and firm. You may forget this step, so you're going to have to consciously think about it. The next thing I'm going to do is insert my catheter bevel side up. It's hard to see these bevels. Okay, I'm going to pull taut on the skin so that the vein is secured and not willing to roll. I'm going to go at a small angle. I'm not going to tell you which one because it doesn't matter. Mr. Jones, you're going to feel a stick. Insert in the vein. You will feel a pop in most cases. Then with one finger, stabilize the needle, advance the catheter down. While the needle's still in and blood is not returning, reach up and remove your catheter. Return your hand above the length of the catheter, firmly press on the vein so that blood does not return. And you can see that I'm getting a flashback here. As I remove this needle, and this is by a compression device, that needle will retract and I keep myself safe. With your free hand, I have already loosened this catheter here on my IV tubing. Sometimes that's helpful, sometimes not. Figure out how you can securely loosen that without contaminating anything. Insert the 2 points. Set that to the side. Make sure that you screw your lure lock down into place and make it firm. You do not want your hand to touch this area in any way because then you will have contaminated your site. Pick up. Notice how I still have my hand firmly on the IV so that it's not going to become dislodged, and I'm doing many things one-handed. Open up your catheter dressing. Place it so that the needle insertion site is covered. Work your way out, get rid of the bubbles, and secure it with one more piece of tape above, maybe on the arm. Label, date, time, initial it, and then thank your patient for letting you start the IV.